All right, welcome everyone to the 2026 International Youth Symposium on Healthcare Medicine and Biotech. So, this is our annual symposium at the Leadership and Innovation Lab that highlights the work of young entrepreneurs and STEM researchers in healthcare, medical innovation, chronic disease, biochemistry, and biotechnology. So, you'll see a wide range of different projects today in that sphere. And we're going to start off with Ethan Wang's Health Atlas project. All right, passing it over to you.
Okay. Can you see my screen okay?
Yes, looks great.
All right. So, hi everyone. My name is Ethan Wang, and this project analyzes melanoma population data in New York State using data from the New York State Cancer Registry. Melanoma is one of the most aggressive forms of skin cancer, but its prognosis is highly dependent on stage at diagnosis. When detected early, survival rates are extremely high. However, when diagnosed at later stages, outcomes worsen significantly. The goal of this project was to analyze real-world registry data and develop an interactive system that helps identify who is most affected by melanoma, where the burden is highest, and what factors may influence late-stage diagnosis. So this project focuses on five major analytical goals. First, quantifying the overall melanoma burden in New York State. Second, examining demographic disparities across age, sex, and race. Third, identifying geographic patterns at the county level. Fourth, exploring factors associated with late-stage diagnosis. And finally, building an interactive analytics platform that allows these patterns to be explored dynamically. The motivation behind this work is that melanoma survival is strongly tied to early detection. When melanoma is diagnosed early, treatment is much more effective and survival rates are significantly higher. Therefore, identifying which populations are most likely to experience late-stage diagnosis can help guide screening efforts and public health interventions. The mission of this project was to translate large-scale registry data into insights that could help highlight high-risk populations. The dataset used in this analysis comes from the New York State Cancer Registry, which records cancer diagnoses across the state. The dataset includes variables such as age, sex, race, county at diagnosis, and cancer stage. To analyze the data, I used Microsoft Power BI, where I built custom measures using DAX, including calculations such as the percentage of late-stage diagnoses and median age at diagnosis. The final result is a multi-page interactive dashboard that allows users to explore melanoma patterns across demographic and geographic dimensions. From this point forward, I'll walk through the main pages of the interactive dashboard and highlight some key patterns that emerge from the data. The first page summarizes the overall melanoma burden in New York State. Across the dataset, there are roughly 55,000 melanoma cases with about 7,600 late-stage diagnoses, meaning around 14% of cases are diagnosed at later stages. The median age at diagnosis is about 67 years, and about 57% of cases occur in males. The trend graph shows melanoma cases over time, which remain relatively stable but fluctuate slightly across the years. The lower visualization shows how melanoma cases increase significantly with age. Most cases occur in individuals over 50, with the highest burden in older age groups. The most immediate pattern we see is that melanoma burden rises dramatically with age. This page focuses on demographic patterns. Here we can examine how melanoma cases differ across age groups, race, and sex. Age again shows the strongest effect. Older age groups have substantially more cases. We also see a clear male predominance, meaning melanoma occurs more frequently in males than females. The stage distribution chart shows that older age groups also tend to have more total cases compared to younger age groups, but less percentage of that in late stage diagnoses compared to younger age groups. Together, these patterns suggest that age and sex are important demographic factors influencing melanoma burden. This page explores the geographic distribution of melanoma across counties in New York State. The map shows how melanoma burden varies geographically, with some counties showing higher case counts or higher late-stage percentages. Below the map is a table that summarizes total cases and late-stage percentages for each county. The scatter plot visualizes how counties compare in terms of total cases and late-stage proportion. This type of analysis can help highlight regional disparities and potential gaps in screening or healthcare access. This final page moves beyond descriptive analysis and explores factors associated with late-stage diagnosis. The key influencers and analysis identifies variables that appear most associated with late-stage melanoma. For example, certain age groups or demographics categories may have higher probabilities of late-stage diagnosis. While this does not establish causation, it helps highlight patterns that could guide further investigation or targeted screening strategies. Overall, several consistent patterns emerge from the analysis. Melanoma burden increases significantly with age, and older individuals also tend to have higher proportion of late-stage diagnoses. There is a noticeable male predominance in melanoma cases, and geographic variation exists across counties, suggesting that melanoma burden is not evenly distributed throughout the state. This project demonstrates how population-level cancer registry data can be transformed into an interactive analytical tool. The dashboard allows melanoma burden to be explored across multiple dimensions, including time, demographics, and geography. It also introduces measures that help interpret stage severity and demographic risk patterns. One challenge in this project was transforming registry data, which is largely categorical, into structured analytical variables. Another challenge was building dynamic calculations in the Power BI that respond correctly to filters without introducing circular dependencies. Finally, interpreting population-level trends requires careful framing to avoid overstating causal relationships. This framework could support several public health applications. It could help identify populations that might benefit from targeted screening initiatives. It could also assist health officials in allocating prevention resources. And the analytical framework itself could be expanded to analyze other cancers or larger national datasets. Overall, this project demonstrates how real-world cancer registry data can be transformed into an interactive analytical system that helps reveal demographic and geographic disparities in melanoma diagnosis. Thank you.
Thank you so much, Ethan. If you don't mind, I just want to ask a quick question of you, which is just have you thought about sort of the long-term potential of your project in terms of whether or not you want it to be freely accessible or eventually something that like an agency, governmental or otherwise, pharmaceutical company, whatever, could like log in and use at pay. Do you think it's something that should sort of like remain free for everybody, or do you think at a certain point you may want to monetize it?
I think for now that's in like I'm not exactly sure yet. Obviously, if it was free for everyone to use, that would have its benefits in that people can see are you at more high risk of this disease or this disorder or whatever. But at other times it might not be, and monetizing it might be a better idea to not provide this information to the public. So I think it sort of depends on how like the overall project plays out and how networking sort of goes.
Yeah, definitely. Some user testing, all that kind of stuff. Cool. Thank you so much. This is a very interesting project. And as somebody who lives in New York State, I appreciate it. Thank you. All right. Next, we have Alice talking about malaria and public health. Thank you so much, Alice. I'm going to pass it over to you.
Should I share my screen?
Yes, that would be excellent. And if for some reason it's not working for anybody, I can help.
Um, can you see the screen? Okay, so hello everyone. My name is Alicia Wang and I'm junior. I have always been passionate about global health, and so I decided to focus on one of the world's persisting disease, malaria. If I were to ask you to describe malaria with just two words, I'm pretty sure that most of you would say mosquito or an Africa. And that's actually a good starting point. So every year, malaria infects more than 200 million people worldwide. And tragically, over 600,000 people die from it. And most of these deaths are children under 5 and pregnant women, primarily in sub-Saharan Africa. But there's the most important thing. Malaria is largely preventable if adequate actions were taken. So, when an infected mosquito bites a person, Plasmodium parasites enter the bloodstream and travels to the liver. From there, they infect red blood cells, which, once spread over the body, cause symptoms like fever, chills, headaches, and severe illnesses. The mosquito responsible are female Anopheles mosquitoes, which thrive in warm climate and areas with standing water and easily adapt to changes in the environment. There are many promising technologies being developed to fight malaria. For example, there are two vaccines currently available, the RTSS and the R21, both approved by the World Health Organization. The former has an efficacy rate of only 40%, and the second one has it at 72%. Researchers are exploring methods like also genetically modify mosquitoes or use Wolbachia bacteria to reduce the transmission, but these two methods are still a myth because they are not yet at any there have not yet been any successful cases. So now you might ask why we can all work together to simply eradicate the disease completely from the planet, and the answer is that it's too expensive. Data shows that in order to do that, 90 to 120 billion dollars are needed with an average annual funding of around 6.4 billion, which is basically impossible to achieve. Compared to all these solutions, which are exciting, expensive, complex, and still developing, insecticide-treated mosquito bed nets are a simple solution that has already been proven incredibly effective. These nets can both create a physical barrier and a chemical barrier, preventing mosquito bites during the night when Anopheles mosquitoes are most active. Studies show that they can dramatically reduce malaria infections and death, especially among children and pregnant women. And here is the most incredible part. A net costs only about $2 each. So that's where my project began. Last summer, after a month of reading, researching, and speaking with people working in global health, I decided to start a small initiative to provide insecticide-treated bed nets to families who need them most. With my mom's support, I partnered with a supplier and produce nets in bulk. Each net is made from durable polyester and treated with deltamethrin, which is an insecticide that repels and kills mosquitoes. So, but buying nets was not the only challenge I went through. The harder part was figuring out how to get the nets to the right people. After weeks of researching and to find a reliable partner on the ground, I connected with International Midwife Assistance, an organization based in Soroti, Uganda. Soroti is a region in Africa of about 250,000 people, where malaria transmission is extremely high due to the climate, seasonal rains, and rural agriculture environment. Healthcare access there is limited, which means that many people cannot receive treatment in time. Pregnant women are especially vulnerable because pregnancy weakens the immune system and makes malaria infections more dangerous. Working with local clinics, volunteers, and the Uganda Ministry of Health, my goal is to distribute insecticide-treated bed nets directly to pregnant women and families in high-risk communities. Something as simple as a bed net can mean the difference between health and illness, or even life and death. And that brings me to why I'm here today. My project, called Nets Go, started as a research, but it quickly became something much more meaningful. I realized that even small actions can have a real impact. If you would like to help, there are a few ways you can get involved. You can support the project by donating, which helps me purchase and distribute more nets, or you can also share the initiative, spread awareness, or even join the project if you like, if you are interested in global health or humanitarian work. Even a small contribution can make a difference. Just a few dollars can help protect an entire family from malaria. If you'd like to learn more, my website and contact information are here on the screen. Thank you for listening, and I would be happy to answer any questions.
Thank you so much, Alice. That's wonderful. Do you want to click back on the slide prior so that people can take a look? Okay, amazing. I will. My question for you is actually maybe very speculative, so it's okay if you don't have an answer right away. But I just think it's an interesting question. Why do you think like we have plenty of billionaires these days? Why do you think no one who like personally has billions of dollars has tried to end malaria? Do you think it's, because it doesn't make them money or because they don't know? What do you think? Why do you think that the people who have that money wouldn't see value in like in sort of paying for it themselves?
I mean, from what I think that's because most people don't even know how to like reach places where malaria is very spread, and so they have to first research or get into contact with people so that they can donate money. But I mean, they would just don't want to do that because it takes a lot of time, and I mean, they are doing the favor, so they just don't want to spend all that time.
Yeah, that makes sense to me. It's like it's a labor of love, and if
Yeah.
if you don't feel that like passionate connection, to like wanting to help people, or if you're not employing somebody whose whole job is to use your money for good, right? Figure out where to donate it for you or something like that. If you don't have your personal philanthropy manager, right, it may not even be on your radar. Do you think it would be worth it for us to sort of lobby billionaires in the same way that we lobby politicians, like asking them, showing up at their offices and, protesting and doing stuff like that? Do you think that that would work in terms of like super rich people, like it would for people who are in public office? Or do you think that like it just like might be too different?
I mean, it's definitely worth to like spread awareness to those people so that if they really want to help, they know how to, and it's already there and they can just um help a little bit. But I mean, I cannot guarantee that each billionaire will want to really contribute to this because they are not really the ones affected and they might just be careless.
Yeah, I think that makes total sense. I think a lot of the crises we're dealing with in the world are the first step to sort of solving them is getting people to care when they think it
Yeah.
doesn't affect them. Or, maybe are privileged enough that it's just like truly never even occurred to them, right? That this is something that they should be involved in. Cool, excellent. I was lucky enough to kind of see this project grow, and I'm really proud of where you've taken it, Alice. Thank you so much for sharing it with us today.
Yeah.
Okay. Now we have Elaine doing a little presentation on my healthcare buddy. I'll pass it over to you. Let me know if you need me to put anything on the screen, but you're more than welcome to share yours, okay?
Okay.
Are you able to see my screen? Okay. All right. Hi, my name is Eli, and today I'll be introducing my healthcare buddy, of which our motto is spread info, not disease. So, My Healthcare Buddy is a youth organization, and we focus on educating younger audiences. So, this includes high school, young adult, adolescents on various health related topics, and these include public health, medical law, just healthcare in general, about the different professions, etc., and bioethics. And so the reason we decided to focus on this scope specifically for Americans, as well as maybe spreading out to internationally to the rest of the world, is because 60% of Americans have a preventable chronic disease. Preventable means that they could have taken some measure in order to not cause the onset of this disease, and chronic as in because they didn't take these measures, it lasts for the whole rest of their life. And so along with these, there are many other problems in healthcare and just generally how to take care of yourself. With the current government administration, public health has reduced funding in order to find alignment towards new administrative goals. The US spends more money on healthcare than any other country with $147 billion annually. And so this causes a little bit of a gap between who can afford healthcare and who cannot, and ultimately also causes how around 31.3 million Americans have never had a medical checkup in their life because they may not be able to afford healthcare insurance or any other reason. And there's also an increased usage of AI in healthcare. If you've heard about robots being able to do surgery or using AI for medical transcriptions, there's a little bit of a breach of privacy as well, and there's many ethical debates. And there's just generally a higher mortality rate in younger generations, whether it be decreased mental health or bad living habits, such as our increased caffeine uptake usage. And so these are all problems that we aim to help solve with spreading information. So since public health and healthcare have both faced significant declines, whether it be reduced funding, decreased trust, shortage of healthcare professionals, and many of the other reasons I listed on the slide prior. So our mission is to combat that by sharing healthcare, law, and public health information in an easily digestible way. And so we do this by having 3 different platforms, and our first one is Instagram, which is our longest lasting. We started this in November of 2024, and the handle is at MHC Buddy. And so on our Instagram, we share different types of information. We have made posts about medical healthcare finance terminology and medical laws such as high-tech or HIPAA, and myth debunking such as myths on organ donation or how cracking your knuckles can give you arthritis. Our second platform is TikTok. We recently started this. It's a very new addition, started in March of this year. And our handle is also at MHC Buddy if you want to search us up. And we decided to start this in order to reach a wider audience, as youth nowadays use TikTok as a very widespread platform on the daily as well. And our third is our website, which we have mhcbuddy.weebly.com is where you can find us. And on it, we post blogs about little blurbs of info, glossary about different medical terms, and there's also an about us in case anybody ever stumbles upon us and wants to learn more. And so while we're not a registered nonprofit, we do have different links to websites on our own website that also focus on public health and share helping out the health of people in different parts of America as well as globally. And we direct our audience to those websites so that they can make donations to those nonprofits that do accept donations from outside people. And so our past accomplishments are that we currently have 850 followers on Instagram, so it is definitely the biggest platform that we use. We have also interviewed local assistance programs about lacking health needs. So these assistance programs may help people with low incomes or children with more educational needs. And so we interviewed them about hygiene health specifically. And so we developed Project Clean features from that, where we inspired youth and our local community to participate in a hygiene donation program for these assistance programs. And so we were able to donate and collect 300 items. And with the winning high school classes that participated in this, we partner with local donut shops to donate donuts to them so that they can be rewarded for doing good on the community. And to the left here, there are pictures of Family Promise, which is a local nonprofit, and the pictures of all the healthcare items that we received. Our future goals are to conduct interviews with professionals in health-related fields at national levels. So now that we've conducted interviews with people at the local level, we would like to conduct interviews at the national level with medical personnel such as EMTs, ER nurses, or those who work in public health, such as people who work for the CDC or NIH. We would like to create wellness challenges on our TikTok and Instagram accounts, whether it be 30-day program where one day you have to hit this checkpoint or complete this goal, or a comprehensive schedule that you can follow on the daily. And lastly, we would like to expand our audience and grow our following, because that is the best way to share info, is to ensure that a lot of people see it so they can spread the word. Thank you.
That's wonderful. I'm curious, and this is just something that I guess I'm just interested in your opinion. What do you think? How can people in the US now, with like sort of like the disabling of a lot of our major sort of like scientific bodies and like, you know, be having it an unqualified surgeon general and all of these different things, how do you think, if you have any ideas, Americans can best sort of get their healthcare information that like maybe they before would have gone to, I don't know, CDC or something, or the FDA or something like that? If people don't really feel maybe like they can trust sort of government health advice, what suggestions would you have for them?
So if they don't really trust government health advice and like a lot of online resources, I think it's plausible that they could go to their local physicians, or if they have any friends who work in the healthcare field, or even if they wanted to sit in on a class at like a community college taught by a professor who's teaching a health-related class, I think it will be helpful and maybe help them understand that sometimes it's okay to trust the government and then there's times when it's not.
Yeah, I think that's a really good point. Sort of reaching out, um, instead of to other places on the internet, reaching out in sort of real life to people around you, especially, I guess, tying this into Ethan's earlier project, the Health Atlas, especially because there are different health outcomes depending on like where you live. So, yeah, I like that answer. I think that that makes a lot of sense. Do you think, again, personally, that sort of nationalized healthcare is where we should try to be going, sort of like, free healthcare for everybody? And then if you want, you know, plastic surgery or something that's like not required or something, you pay out of pocket, versus sort of, the insurance system that we have now. A lot of people, have talked about over the last decade, sort of even longer than that, maybe changing the healthcare system. Do you think that that needs to happen, or do you think the healthcare system we have now is fine, but like it just, we need to learn more about it. We need to be more engaged. What do you think?
Yeah. So if I were to say if healthcare was a privilege or a right, I probably lean more towards a right, because if you're a citizen of the US, it's just a lot of other countries are able to provide free healthcare, so why shouldn't we be able to? Even though I know it's very expensive because the US has very advanced medical technology, there are still certain rights that should be guaranteed to everybody, even if you're not able to pay it. And that's just how I feel about the topic.
Yeah. I mean, in many other areas of life, right, we try to guarantee food to people, or, some sort of access to shelters, we're not great about that either. But yeah, I take your point. I definitely think that among the things that the country is fiscally able to do and sort of in line with its principles, I think it would probably make sense for us to be working towards that for sure. And with like income inequality and everything like that. Yeah, yeah, for sure. Thank you so much. Your project has grown wonderfully, and it's lovely to get a chance to see you today. All right. Next, we have Suhani talking about light pollution and human health. Welcome.
Hi, ma'am. Hi, everyone. I'll just share my screen. Is it visible on slideshow?
Yes, looks great.
Thank you. Hi, everyone. I'm Sahani Gupta, and I will be talking about light pollution's impact on human health. So, light pollution is a term we probably haven't heard of a lot. There's water pollution, air pollution, land pollution, even noise pollution. But light pollution an is an environmental issue that we generally overlook. So my aim today in this symposium is to raise awareness about light pollution's impact on human health and why it should be considered as a public health concern. There's a very very famous quote that goes around for light pollution: in search of gold we are losing diamonds in the sky. So what happens is that if we analyze both of these images, they aren't of the same place, but the second image where we can see an entire galaxy in the sky could potentially be the first image but a few years back. Because of development and industrialization, a lot of our a lot of places on earth have been consumed by excessive lighting, which probably isn't even required at the scale that we are currently utilizing it. And therefore, this light doesn't just stay contained to our cities, it spreads around everywhere into the atmosphere, into the neighboring forests, and essentially creates a haze which is related to a lot of health concerns. So, what is light pollution? Currently, it's a huge issue because 80% of the world lives under it. So, most of the populated regions around the earth, so this is a 2024 satellite data mapping of light pollution around the earth. um, we can see that the populated areas and have extreme amounts of sky brightness at night. So the red areas are where there's excessive light pollution, then we go to yellow, then we go to green, and then there's a lot of gray space on the map where there isn't significant lighting, but those are also areas in the world which aren't populated. So light pollution is basically when the natural patterns of light and darkness get altered in ecosystems because of artificial lighting. So, lighting, the brightness of the sky due to the moon is not considered as light pollution, but if we have excessive street lighting, which basically brightens the environment around us at night, it's considered as light pollution. There was a study which correlated night sky brightness levels from 2011 to 2022. And researchers observed, that the night sky is becoming 10% brighter every year. So, light pollution is visible to us in various forms. The most common and most visible one is sky glow, where light basically directed to the atmosphere gets scattered and then it basically creates a haze and a dome around wherever we are living. The next is clutter, where there a lot of bright lights are actually placed together, and they're so bright in your eyes that you can't process the surroundings around you. The third is glare. For instance, no, you're not driving. For instance, you're on the highway and there's a car with full beam coming up ahead. It hits your eyes, which is like extremely sharp to your eyes. So that contrast between the excessive brightness of the light versus the dark surroundings is known as glare. And fourth, we have trespass. Trespass is basically when at night, outdoor lighting from probably a stadium or just street lights or cars is entering inside your room and it's unwanted. You're trying to sleep, but there's light which is disturbing you. So to study the prevalence of light, I first conducted a survey around my city and asked people if they've ever experienced sleep disturbances due to outdoor lighting. And the responses were quite alarming, considering that people have said that outdoor lights are extremely bright wherever they live, and they have linked sleep disturbances to light pollution. So, what I did was that I conducted a citywide investigation of light pollution levels. I created my own sky quality meter using an Arduino and a light sensor, and I went to different places in the city and mapped light pollution levels in different places. So, this extremely cluttered slide is basically my findings. So the lower the magnitude that has been presented here on the slides, the higher the sky brightness. So we observe that commercial areas, residential areas, and hospitals, all these areas show excessive sky brightness, which isn't good because these are places where we are living, right? And light pollution, as I will be talking about in future slides, is linked to a lot of health concerns that we must be aware of. Therefore, this is an issue that we really need to look up. We need to take up, and we need to work towards reducing. The biggest, most concerning point on light pollution is that WHO and the International Agency for Research on Cancer has classified it as a potential carcinogen. So, one of its reports was about night shift work. So, what happens is that when someone is working late at night and they're exposed to excess light, it disrupts their circadian rhythm. So essentially, night shift work gets traced back to excessive lighting at night, which we can trace back to light pollution. And therefore, it has been classified as a potential carcinogen group 2A. And studies have linked light pollution to increased risk of breast cancer in females and prostate cancer in males. Now we study this from a biological perspective. So what happens is that light enters our eyes, and through a tract which connects our retina to the hypothalamus in the brain, um, basically a signal goes to our brain which tells the pineal gland whether to produce melatonin or not to produce melatonin. So melatonin is a sleep hormone which induces sleep at night. If there is excessive sunlight in our environment, then our brain basically tells the pineal gland to reduce and inhibit its production of melatonin and produce cortisol. Cortisol is our alertness hormone. So what happens is that when during daytime, this is the reason why we're awake. But the moment the sun goes down and our environment is dark, it becomes a stimulator to produce excessive melatonin, and that's how basically our sleep awake cycles work. When we have artificial light surrounding us, then it basically tricks our brain into thinking that it's actually daytime, which messes messes with our entire system of melatonin production and suppression. So this is basically how hormone production takes place at different times of the day. So cortisol is at a high around noon and melatonin is at a high during midnight. But what happens is that when we're exposed to artificial light, especially blue light. So why blue light? It's because we associate daylight with blue light. So what happens is that especially when we're exposed to blue light, it suppresses our melatonin production and basically shifts our body clock in the circadian rhythm. So the circadian rhythm is basically the sleep awake cycle in our in sleep awake cycle, and if our melatonin production gets suppressed, then what happens is that our sleep timings, our body clocks get shift to a later duration. A Harvard study in 2003 basically reported that if a person is exposed to 6.5 hours of blue light, it delays the body clock by 3 hours, which is not healthy for us, considering we wake up early and we sleep late. So the sad reality is that blue light is everywhere. While our circadian rhythm in its early stages evolved for firelight, moonlight, which did not have as much of a concentration for blue light, now we're exposed to devices. We have LED lighting, which has white, blue lighting, LED lighting, and then we have smartphones, laptops. So all of these expose us to blue light for an excessive duration. This delays our body clock, delays our sleep, deep sleep, disrupts our circadian rhythm, which over a long period of time leads to sleep disorders, cardiovascular diseases, obesity, and as was mentioned before, becomes a cancer risk. For children and adolescents, the situation is even more grave. So, when we're an adolescent, what happens is that during puberty, our circadian system, our circadian rhythm naturally shifts by 1 or 2 hours. And what happens if we combine that with artificial light, which postpones our sleep cycle by a few more hours? It's not going to work out with the fact that we're waking up early during school. So essentially, this leads to sleep deficit. So most of us, we get less than 6 to 7 hours on school nights when 8 to 10 hours is recommended for maximum development during adolescence. And this leads to a lot of other issues, which we see prevalent when we're at school. So concentration disruption, learning efficiency, memory capacity, reaction time issue, and then the long-term issues of metabolic disorders and obesity. Now I'll show you a few images. So this was a typical street lighting perhaps a few years ago. So what we observe here is that light is being radiated everywhere, but we don't actually need that much light. We don't actually need that much light present, like going everywhere into the surroundings. The section of the bulb which is getting directed towards the sky is completely unwanted. We do not need it. We only need the light which is directed towards the ground and is helping us. So these are a few lighting designs which have been proposed by different international organizations focused on light pollution, combating light pollution. So the best solution is having a shielded light. Oh, I'm sorry. Yeah. So this is actually a comparative study in Los Angeles. This was actually posted by NASA. So a time scale comparison of lighting on the same road. So initially there was incandescent lighting, yellow lighting, but it used to go up to the skies. So we can see that when we implemented shielded lighting, it heavily reduced the amount of light that is going towards the sky. So it shielded that lighting and directed it towards the ground, which also actually improves energy efficiency if you think about it, because the amount of energy that was going towards the sky, going towards producing light that goes towards the sky, is now getting redirected to the ground. So all in all, we're getting more efficiency out of our light bulbs. So here are some of the lighting solutions that we can implement. First of all, that we can switch to warmer lighting. Warmer lighting reduces the blue light component of lights and hence hence has a lower impact on our circadian rhythm. Second, we have shielded lighting, as I just mentioned. Next is that we sometimes excessively light our environments. We do not need that. We can control the amount of lighting that we actually need. We can optimize our lighting designs. And fourth is smart systems. Implement motion sensors. For instance, you don't need light 24x7. When a street is empty, you can just turn the lights off. So to address all these issues on a local level, I founded my nonprofit known as Starlight. So our mission is to first raise awareness for light pollution and its health impacts, and encourage responsible lighting practices. So some of the initiatives that we do under the nonprofit is that spread awareness through forums such as the Symposium, conduct stargazing sessions, citizen science initiatives, and then advocate to policy. So policy advocacy is something we haven't done yet, and we look forward towards doing. This is SkyQI. So Starlight's flagship citizen science initiative is SkyQI, where basically it's like a map and a portal where you can upload photos of your night sky. So there's an algorithm which calibrates those images from your smartphone and analyzes the sky brightness and gives a bottle scale reading. Bottle scale reading is basically how bright the sky is, maps it from a scale of 1 to 9, and tells you how bright your sky is. It plots them on a global map so that we can visualize how night sky brightness is in different parts of the globe, of the world. And additionally, SkyQI also has blogs and informs people about what basically about the project, about light pollution in general, about solutions we can implement, etc. So Starlight is currently in its very nascent stage. We are an organization that is currently in formation, and we're looking for new members. So if you believe that you can contribute in any of the following ways, as shown on the slide, we would love to have you drop an email on starlight.darkskies@gmail.com. We would also love it if you guys could try out SkyQI and test the night skies where you live so that we can map light pollution levels and then bring more awareness towards this issue. I also like to write about light pollution on a Substack page, Bring Back the Night Sky. And I would love it if you guys could go and give it a visit. Thank you.
That is awesome. Thank you so much. The project has grown really lovely since the last time we chatted about it. And you've given me so much ammo to use against my husband, who loves to have all the lights on. So I'm personally thanking you for 3 to 5 key facts I'm going to be bringing up later today. Thank you so much. And I will definitely send around the information to our incoming Lil students who may be looking for something to join. So thank you so much.
Thank you.
Any sort of last personal thoughts on sort of light pollution and where we are in the world, how we can you know, keep this in the front of our minds?
Yeah. So if you think about light pollution, I think if you're not going towards the public health, just think about the stars. It's not okay to just see 7 stars in your sky right now. You should try to focus and bring more stars back, protect our night skies, and just join the mission towards light pollution.
I love it. Excellent. Yes, I agree. As somebody who lives in the middle of nowhere, take a day a day trip to some place, spend the night, and see how cool it actually looks up there. Because it's when you really get a look at the skies outside of light pollution, it does sort of feel unreal. It's pretty
It does.
incredible. Amazing. Thank you, Suani.
Thank you.
All right, Ryan, last but certainly not least, please bring us into the world of Bright Beats for our final presentation. Welcome.
Hi everyone. Okay, let me share my presentation.
Yeah, and if you need help with anything, just let me know.
Okay. Can everyone see my screen okay?
Looks great.
Okay, perfect. So, hi everyone, I'm Ryan, and I'm going to be talking about my organization, Bright Beats. So, in essence, Bright Beats is a youth-led 501c3 nonprofit, and we help special needs kids through engaging interactive music programs. Oops. Okay. So before I get into what we do and what we've done, I want to talk about our team. So unlike a traditional student club, our team has several layers. So we start with our executive team. I'm the president, and then we have 3 VPs, and they all focus on different aspects of our organization. So for example, Hasani focuses on communications, Zachary focuses on programs and volunteers, and Amber focuses on connecting with worldwide organizations and maintaining our global chapters. And we also have several chapters in other locations. We have a Texas chapter, a United Kingdom chapter, and also a chapter in Uganda. So we have this really large leadership team because we really want the youth to hone their leadership skills and be able to gain the skills that they need to have success in the future. So now for some background information in Brightbeats. So we serve special needs children, and this is a really important community to serve because 1 in 6 children have developmental or learning challenges. So special needs and developmental challenges is really prevalent in the children population. And a lot of programs for these children are inaccessible or costly because they may not be catered towards this population of children. And additionally, these children have barriers regarding communication and may face challenges in inclusion. So Brightbeat serves children's ages 3 to 17 with developmental or learning challenges. And we're always looking for families who are looking to have a community event or just looking for other people to connect with. And we also look for schools and communities who are interested in our programs. And this is our solution to this problem. We have the biggest part of our program is the music engagement sessions. We have inclusive interactive sessions using rhythm, melody, and movement, and they can be either in person with like library sessions, for example, or we can have virtual sessions with like one-on-one sessions with volunteers and families. And to keep our program accessible for everyone, we maintain a 100% volunteer-run program, and we ground our programs in neuroscience and music therapy research in order to best serve these communities. So these are the different types of programs that we have. So first and foremost, we have school partnerships, which include our after-school or summer events, and they are always located in special needs classrooms. And we also have community events, which are really popular among the locals. They are large, inclusive events at libraries or community centers. And we also have partnerships with other organizations who have events, and we offer our services there too. As I said, we have virtual sessions in which volunteers can connect one-on-one with families. And we also have a Youth Leadership Academy, which just goes into the idea of helping youth gain important leadership skills to succeed. So here are some pictures about our previous sessions. These are some examples of sessions we've had in schools. And some more pictures with virtual sessions and our partnership with our Africa chapter and organizations. So by the numbers, we have currently 5 locations. I forgot to mention earlier that we also have a China chapter, and we have 10 global partners, so partners that are local, like schools and libraries, and also various special needs, autism organizations, and student clubs as well. And since 2 years ago, we've served around 2,500 families through our outreach events, our community events, and we've also gained around 5,000 volunteer hours. So here is a list of our partnerships that we've had so far. This isn't an extensive list, but so we partner with our schools, community organizations like Parents of Autistic Children. We had a winter celebration with them. And we also partner with the African Child, which is an organization serving special needs and kids with disabilities in Uganda. And we also partner with Sunny Teens Academy, in which we share information about each other and see how we can best support each other. And we also partner with several student organizations. For example, we partnered with Melodies as Medicine by distributing some of their CDs to people who come to our events. And we've also partnered with Key Melody, which is a student organization in China, and they serve younger kids through also interactive music programs. So here is our 6-month roadmap, what we want to do in the next 6 months. We want to get more youth volunteers and recruit and train them to join our events, expand our reach around the globe, launch some new chapters in other locations, and potentially a couple new community partnerships. And we also want to upgrade our session quality, which could mean purchasing new instruments, purchasing new technology, microphones, things like that. So we've made it to the end of my presentation. If you're interested in becoming a volunteer or seeing how you can get involved with helping special needs kids through music, if that's something you're interested in, you can sign up as a volunteer on our website, www.brightbeats.org, or you can learn more about us on our Instagram or Facebook. Thank you.
Amazing. Thank you so much, Ryan. My question for you is, what surprising things have you learned about yourself through this process? I know I'm taking you a little off topic, but since, we've been lucky enough to hear about Bright Beats at more than one of our conferences, I'm really curious, just what have you learned about yourself during this process, yourself as an entrepreneur or as a, advocate for health equality?
Yeah, definitely. So that's actually a question I've been thinking about recently. So one thing I learned about myself is that it's really important to value what other people think and listen attentively and not dismiss an opinion or a thought because it could be really valuable. And I learned this through just interacting with these children. Sometimes it might not I might not understand what they want or what they're doing in the moment, but as I try to understand them, it starts to make sense that they do have a plan, they do have a goal. They're not just doing random things or trying to cause a mess. And an example of that recently was in one of our programs, there was a kid who wasn't sharing an instrument with another kid. And I was a little bit confused why they couldn't share because it seemed like a pretty easy thing. But in reality, it was because the kid wasn't done with his turn using the instrument. He actually just got there. So it all made sense in the end.
Yeah, learning how to listen to kids is hard. It's something that all of our parents had to hopefully eventually figure out. But yeah, learning learning how to listen even when listening's not easy. Yeah, that's a big skill. That's a big skill. Thank you so much, Ryan. And thank you so much, everyone else. Wonderful presentations today. I learned a lot. I think all of these projects are going in a really lovely direction. And they showcase the healthcare medicine and biotech part of our little community very well. So I'll just sum up again for anybody who came in on the later end. Today's been our annual symposium highlighting the work of young entrepreneurs and STEM researchers in healthcare, medical innovation, chronic disease, biochemistry, and biotech. If you want to join any of these projects, regardless of whether or not you got a chance to copy down information during the talks, you can reach out to me or whoever your connection is through the Lil community, and we will put you in touch with these amazing founders. You'll also be able to find the information about how to join these groups in the upcoming issue of Legacy Gazette, our in-house magazine. If you want to know more about Lil's medicine-oriented programs, that we've released a couple of new ones this past year, and you can find those at our website, leadershipinnovationlab.org. Thank you very much, everyone, and have an awesome weekend.
Thank you.
Thank you.